My brother became an EMT and a firefighter first, and I followed his footsteps. I became an EMT at 16, and I took the test when I was eligible, and I got hired at 24 as a firefighter. My name is Brian Kelly. I'm a firefighter and emergency medical technician for the Village of Ridgewood, and this is my story. So a couple years ago, I went to this free medical exam they offer for first responders. It's called a gift from Captain Buccio. Captain Buccio was a fire captain in Jersey City, and he unfortunately passed away from a heart attack, and his widow created this program for first responders to get a free health exam. The first time I went was I had a life-changing medical condition that I found out on the echocardiogram. Basically, I got a phone call from the doctor that ran the program, and he said, hey, you have this aneurysm. And he's like, you need to go see a cardiac surgeon right away.
An aortic aneurysm is basically a ballooning or sometimes even a bulge of the aorta inside of your chest. And once a complication occurs, we have very limited amount of time to try and save somebody's life.
My anxiety was through the roof. I told my wife, I said, Jackie, my heart problem's starting to go in the wrong direction. And I basically said, we're gonna go meet the surgeon and we'll go from there.
After Brian came to us, we went through a detailed patient history, looked at all his risk factors as to maybe why he developed this, did family screening. Some other things came up that really put this young gentleman in a place where he needed surgery.
I went through Thanksgiving with my family, my Christmas, two of our favorite holidays in our family, and then my son's first birthday, and that's when I got the phone call. I called my wife right away. I said, you gotta take off of work tomorrow. We have to go see the surgeon. And I said, I think we're going in for open heart surgery.
What he underwent was what we call a David procedure, and that's where we remove an aneurysm around the patient's aortic valve, and it allows them to keep their own aortic valve, because no replacement for a valve option is as good as what we were born with. But what we do for the aorta is pretty darn close.
February 9th, that was the date. There come the two nurses, and click of the stretcher brake, and the feeling is just, it's so long. It's like, it took forever going down the hallway. And doors open up, I hear Bruce Springsteen playing. Oh, my wife totally requested this, and I heard a laugh from every person in there. Everybody just started laughing. And, but there it was on the table, lights out for me. It was a grueling couple of days in the ICU. I had to get fluid taken off my lungs. I had a needle on my back. All these wires and tubes, and go from that to 14 weeks later back to full duty is something like, it's a miracle. Obviously the first month after my surgery, I couldn't really do anything. But once I got cleared to drive and I could start cardiac rehab, that's when I was like, okay, it's time to, so let's bump this up a little bit. May 10th was my graduation day, and it was emotional because, it's like, you had to work so hard, and I did it. It's good to be doing well, and I feel great. At the cardiac surgery office at Valley, I knew I was in good hands. I knew I trusted him with my life, obviously, and especially Dr. Jabaji. He, one of the most terrific people we've ever met, and he's family to us now. And the care is world class.
Brian's recovery after surgery has been quite remarkable. He's gone back to full activities. Sometimes I run across him bringing in patients into our emergency room, and it's just a complete joy to see him being able to do such a strenuous job after having a surgery for his aneurysm. And most importantly, he's able to be the dad that he wants to be to his young child as well.
During my recovery, I was able to see his first steps. That meant a lot.
And look who's here.
Hey, how you doing? Good to see you again.
Yeah.
We were just talking about you.
I heard. Really?
Yeah. It's completely rewarding to see Brian back at his job with full duties, no restrictions, and doing what he loves.
I'm here, I'm alive, and I hope my story can help some first responders out to go get checked out. Had I not gone to that appointment, had I not found out I had this aneurysm, 100% would have been fatal. The whole Valley Hospital is taking care of our family, and we're forever grateful.